I came to see Dr. Rihani because I just turned 50 and I'm really noticing these heavy lines more and more and more. So I do this every time I get the mirror. I know when I do my eyeliner, it's starting to, instead of being a cat eye, it's starting to droop and it really bothers me. So my eyes, I'm starting to get these wrinkles. I just feel like I want it lifted. My cheeks and my neck are some of the main things that are bothering me.
Anytime a patient like Becky comes to me, we take this very seriously because Becky's career is actually modeling. And so her face is on camera all the time. We have to be very careful about our incision placement and every procedure that we're doing, that we're not doing too much or we're not doing too little, and that we want this to look like Becky when all is said and done. So I'm here with Becky today. Hi Becky, how are you? Good. Becky's come in today to discuss some changes that she's noticed in her face. And so I'd like to go over those changes with you today and talk about how we're going to be addressing those surgically. So let's start with the neck. Becky's noticed that she's basically gotten some extra skin here along her neck, and she's starting to see some vertical bands that are appearing as well. And the reason that we see that is that actually this muscle in the neck is starting to relax. And just as that skin is losing a little bit of elasticity, you're starting to see a little bit of extra skin here. The way that we treat that is actually by doing what we call a little platysmoplasty, or a little incision underneath the neck. We tighten this muscle up, and then using a neck lift, we can actually go in and lift that skin and muscle from the back edges of the muscle to give her that really sharp jawline. Becky, I'm gonna have you turn your head a little bit for me as well. Same thing's happening in the cheek. Some of these fat pads are starting to drift down. And so what we're going to be doing is picking all that up using deep plane facelift techniques and just repositioning it in a more vertical vector. So we're going to be lifting that, okay? So that's gonna be addressing her concerns in the cheek and lower neck. We also talked about her eyebrows. So her eyebrows over time are starting to come down a little bit. Ideally, in a female brow, the arch and the tail are a little bit higher than the head of the brow. And so we want an eyebrow shape that's actually going to be a little bit more open, like so. And so what we're going to be doing is called an endoscopic brow lift. These are using small incisions behind the hair, and that's going to be repositioning everything in a more vertical fashion. That's gonna really open up those eyes. Notice that she's starting to see some of those under eye bags. And so the way that we address that are really two different ways. One is that we're going to do a very conservative tightening of the lower eyelid and addressing some of those fat pads that are getting a little bit larger. The second reason for her having that is that she's actually losing some volume here in the cheek. And so we're going to be doing a very conservative fat transfer. That's gonna be taking a little bit of fat and just giving her a little bit more projection to the cheek. That's gonna restore some of those youthful contours in the cheek to really kind of soften what she's noticing, which are some of these little under eye bags here. Obviously she looked great. These are really fine-tuned things that make a millimeter or two of difference, but they can really provide a really rejuvenated appearance. All right, so we're here on surgery day, exciting day. And the first thing that we always do is mark the patient. And the reason is that she's sitting up. We can see the effects of gravity, and I'm able to just really see all the little lines and things like that I can really conceal these incisions. So it's allowing me to also review everything that we're going to be doing during surgery with the patient so that we're on the same page. So today we're doing a facelift, we're doing an endoscopic brow lift, lower blepharoplasty, fat transfer, and laser resurfacing. So I'm always usually starting with the marks for the facelift, so I'm gonna do that now. So the first incision that I'm marking is the facelift incision. Actually going behind this part of the tragus, or this little cartilage piece. Marking this incision here. This is going to go around the earlobe. Okay. Turn a little bit more part behind the ear, I'm actually finding out where this incision is going to be well healed and not visible. And so this is actually going to go back in the hair so that she'll still be able to wear her hair up. For the brow lift, we're going to make a small incision here. We're just marking the superior temporal line there. I don't want to mark the nerve, so I'm marking out this line here. That shows me where the nerve that goes to the forehead muscle is. I'm marking out some of the ligament attachments. In the face, when we're doing a deep plane facelift, all these are going to be released. Okay, turn straighten up. For the lower eyelids, I'm going to be marking in the first wrinkle. Look straight up. This is going to show me where that little incision is going to go. This heals up really nicely. This is a low tension incision. Smile for me. Relax. Going to hide this in a natural smile line coming down this way. Okay. And then we're marking just the areas of volume deficit so that we know where we're putting the fat. Putting the fat here in the temple. Okay. I'm going to be putting a little bit of fat here in the nasolabial fold. And then we're going to be doing just a little bit here in the marionette lines here as well. Smile for me. I like to mark the midline of the chin as well. When we're adding volume, I want everything to be very symmetric. So those are the marks for the endoscopic brow lift, the face, which is the cheek and the neck. We have our platysmal markings here to address those bands. We have the lower eyelids marked, and then we have all the areas that we're going to be placing fat. All right, so our patient is now marked. We have a great plan for surgery, and the next step is going to the operating room and giving her a wonderful result.
Now that the procedure is done, I am so grateful. I'm super glad I had it done. I would do it over and over. Now, if I gave advice to somebody that was going to get a facelift, I would say, just go for it. Just do it, because I was nervous about it. I, for a couple of years, thought about it, and I finally did it. And thank goodness I went to Dr. Rihani, because I don't even feel like I had a face, like I don't look like I had a facelift. I look just refreshed.
All right, so let's review how her scars are looking at 3 months. Keep in mind that these are still healing scars, and so they're still going to be a little bit red, but there's actually 2 very small incisions up in the hairline. Those are behind the hairline, so they're very difficult to see. All the hair is present, there's no hair loss. The facelift scars are done through little incisions around the ear, so it curves around here, comes down behind this part of the ear and loops around the earlobe. The ones behind the ear go up, back, and down along the hairline. And you can see that that's healed well, that she could wear her hair back and no one would notice. There's a small incision underneath the chin. A lot of people are concerned about, placing a scar into the chin, but it actually heals beautifully. It's in a natural crease. That's allowed us to go in and address the bands underneath the neck. She actually has a small incision underneath the eyelashes. And that's healed beautifully as well.
If I gave advice to somebody that was going to get a facelift, I would say, just go for it. Just do it, because I was nervous about it. I, for a couple of years, thought about it, and I finally did it. And thank goodness I went to Dr. Rihani, because I don't even feel like I had a face, like I don't look like I had a facelift. I look just refreshed. So Dr. Rihani made that happen for me. So if you're going to get a facelift, you need to find somebody, in my opinion, that only does faces, which was Dr. Rihani, and that's why I chose him ultimately. And the other reason is you need to find somebody that only does faces, but also is going to do your face the way you want your face. I wanted natural. I didn't want to look too pulled. I didn't want to look crazy. I wanted somebody that was honest with me and that would be conservative, but also get the effects that I wanted. And Dr. Rihani delivered all of that perfectly.
If you're interested in checking out Becky's before and after results, or some of my other patients' results, Go to facialplasticsurgeryinstitute.com for a full gallery and some case studies on patients just like Becky.